Joining us for our Monday COVID-19 briefing, where we want to give information regarding our efforts all across the state as we move forward in mitigating the spread of this virus, as we move forward in rebooting our economy, as we move forward in efforts all across Tennessee to battle this pandemic and to mitigate the impacts that it's had from a health standpoint and an economic standpoint. Thank you for joining us today. Earlier today, I spoke with Vice President Pence on a call with governors from all across the country regarding expanding testing capacity and how states are working at a rapid pace to make sure that more and more of their citizenry can be tested, especially those that are outside the realm of traditional COVID-19 symptoms. Expanding testing capacity is a very important step as we begin to safely reopen our economy, and it's why we continue to emphasize the importance of that. It's also why over the weekend our Unified Command Group popped up 19 drive-through testing facilities across the state. We conducted more than 11,200 free tests for Tennesseans, many of which did not have traditional COVID-19 symptoms. This surge of tests accounts for the largest number of tests conducted in our state over a two-day period. In total, we've conducted over 100,000 tests statewide so far in Tennessee. I want to thank the local health departments that were so important and continue to be so important, our EMS agencies across the state, our first responders, law enforcement that were a part of working with the National Guard, and I especially want to thank the National Guard for their efforts in expanding testing to Tennesseans who have now been challenged with the idea that when they're in doubt, they should get a test. I was actually at one of those testing facilities this weekend, and it was inspiring to watch. There were long lines and lots of folks that responded. We had an overwhelming response to our efforts to provide testing to people all over the state, and I watched law enforcement locally, local officials working with our health department and our National Guard to make sure that people got tested. And as said before, it was quite an experiment in expanded testing, but it worked well, and we tested thousands of people all over Tennessee, and we didn't turn away anyone, but it's important to remind everyone that we don't want to turn away anyone from tests. If you believe that you need a test, we want you to get one. And what's important to remember is while these weekend testing surge capacity pop-up facilities are available on Saturdays and Sundays in different locations, and you can check the website to find out where those are located, that same free testing is available in our public health departments 5 days a week in every rural county in Tennessee. So you don't have to wait until the weekend. If you can actually get a test during the week, we urge you to go to your local health department and get that testing as well. Today in our state, we have 7,238 confirmed cases in Tennessee. We have lost 152 Tennesseans to COVID, and 3,575 have recovered in our state. That's a 2.3% increase in the number of confirmed cases over yesterday, which is our lowest day-over-day percent increase to date. Now, we know this battle will continue until we have a treatment or until there's a widely available vaccine, but for the time being, we continue to flatten the curve in Tennessee. From one end of our state to the other, Tennesseans have done what we've asked them to do. And we're seeing their hard work and their dedication to each other pay off. And we thank you for all that each one of you individually has done. As we've challenged you to do so over these weeks, you have done just that, and it has paid off. For 17 consecutive days in Tennessee, we have seen only single-digit percentage increases in the number of cases in our state. Our hospitalization rate has consistently remained lower than national averages. And as of today, the number of recovered patients exceeds the number of active cases. This trajectory of symptoms and cases and hospitalizations shows a very encouraging sign. It's a very encouraging slow to the movement of the virus across our state. Our efforts to secure personal protective equipment and critical medical supplies is also very encouraging. While a lot of states have faced shortages and currently do in PPE, we've ordered more than 35 million pieces of personal protective equipment in Tennessee, $82 million worth, and we continue to aggressively procure this life-saving equipment for our frontline workers, particularly our healthcare workers. And again, I want to thank healthcare workers all across the state for what you're doing. Putting yourself in the front lines, doctors, nurses, frontline workers that are protecting the public from COVID-19. We want to make sure that you have the protective equipment that you need, and we're working hard to make sure that you do. So while the health outlook is showing signs of improvement, our economic outlook tells a very different story. Record unemployment numbers, thousands of businesses closed. Social distancing works, and as we open up our economy, it will be more important than ever that we stay committed to that. Lives and livelihoods depend on it. But here's the reality. For the good of our state, social distancing must continue, but our economic shutdown cannot. While we continue to emphasize social distancing for Tennesseans, I will not extend the safer at home order past April 30th. And moreover, we are working around the clock to be certain that some businesses will be able to open as soon as Monday, April the 27th. We will be outlining the measures and those particular businesses in the next couple of days. And it's our firm intent that by May 1st, the end of next week, the vast majority of closed businesses in 89 Tennessee counties will be allowed to reopen. These businesses will open according to specific guidelines and guidance that we'll provide in accordance with state and national experts in both business and in medicine. I mentioned opening up in 89 counties because those are the counties where the state has health departments. Each of these counties will be covered under our forthcoming guidance, and we'll be communicating with them directly about our plans to reopen the economy. For the businesses in our remaining counties, the 6 Tennessee counties with their own health departments, we'll continue to work with them as they develop their own plans to reopen. These counties are Shelby, Madison, Davidson, Hamilton, Knox, and Sullivan, and we want to be supportive and cooperative in working with them to develop their own plans. I'm not extending the order past the end of April, but we're working directly with our major metropolitan areas to ensure that they are in a position to safely reopen as soon and as safely as possible as well. I want to talk a bit about our economic recovery group. It's 30 leaders from the public and the private sector that are working around the clock to create this guidance to assist businesses in a safe reopening in our state. The industry representatives participating in this economic recovery group represent 140,000 Tennessee businesses, and they employ 2.5 million Tennessee workers. I want to thank those who are a part of this economic recovery group, these industry leaders across the state. They genuinely and literally are working every day, day and night to make sure that we can get the measures needed to provide for businesses so they can begin opening next week and on into May. The ERG is engaging directly with the business community to develop a Tennessee-specific plan for revamping our economy here in Tennessee. Our small businesses have suffered tremendously through this COVID-19 pandemic, and I've instructed Commissioner Ezell to work quickly with this business community so that we can reboot our economy beginning in April and extending into May. Now, as we work toward a phased reopen, I've instructed also our state parks to begin reopening this Friday. There will be further details announced regarding what parks will reopen, but we look forward to offering Tennesseans the chance, again, to get out and enjoy the outdoors in the spaces of our state parks beginning this week. Many of our efforts to fight COVID-19 have been outward-facing, but we have been hard at work to protect vulnerable populations as well, including inmates within our correction system. I've asked Commissioner Tony Parker to join me today to offer a brief report regarding the efforts in our state prisons. Tony?
Thank you, Governor, for the opportunity to discuss the work that we're doing in the Department of Corrections as it relates to COVID-19. Of course, COVID-19 has been a special concern for us, as in our correctional facilities we consider a vulnerable population. And in that population, we have a less opportunity to have and to practice social distancing. As most of you know, the Department of Corrections took an early precautionary step on March the 2nd by suspending all visitation and volunteer services at all state prisons in order to limit the traffic that enters our facilities. Additional precautionary steps included postponing all legal visits with the exception of certain special circumstances, reducing the number of inmate work crews, as well as suspending all emergency inmate transports and intake from the county jails. We have made modifications to our inmate programming. Medical co-pays were suspended for all inmates. Additional soap and cleaning supplies have been provided to deliver the inmates free access. We have also delivered inmates free telephone calls that were provided by our vendor GTL so inmates could maintain contact with their family members at home. All inmates as well as staff were issued masks to wear. On March the 16th, all of our facilities began conducting non-invasive screenings for staff and inmates. Temperature checks were conducted and a series of screening questions were asked of staff when they reported to work. Inmates receive temperature checks and health assessments twice each week and are closely monitored for any signs and possible symptoms. Inmates who are in isolation or in quarantine status, in addition to regular medical care, they're provided twice daily health assessments to include temperature checks. TDOC's first positive case was detected on April the 1st in a contract employee. As a result, we quarantined 3 inmates at the Bledsoe Correctional Complex who may have been potentially exposed to the contract employee. Since that time, the 3 inmates have been released from quarantine status. On April 3rd, an inmate at the Attorney Center prison who was taken to the hospital for an unrelated medical issue tested positive while he was at the hospital and actually getting ready to be discharged. During that time, we had 2 additional contract employees and 3 TDOC employees test positive, which prompted our decision to launch mass testing for more than 1,000 employees at Bledsoe Correctional Complex and Northwest Correctional Complex. I want to thank you, Governor, for dedicating the resources toward that effort, which resulted in 1,145 employees being tested. 13 state employees and 6 contract workers were positive for COVID-19. The result of 1,126 of those employees, their tests were negative. On Saturday, April the 18th, we launched a second proactive mass testing in conjunction with the Department of Health, our medical provider Centurion, and the Governor's Unified Command. 425 inmates at the Bledsoe Correctional Complex were tested. Of those, 150 tested positive, and we have been isolated at the facility. The vast majority of those who tested positive were asymptomatic, and we still have approximately 10 tests pending. Since our first positive inmate test on April the 4th, there have been a total of 174 inmates at 4 facilities to test positive for COVID-19. 163 of those positive inmate cases are at the Bledsoe Correctional Complex. 5 tested positive at Attorney Center Industrial Complex, and at Northwest Correctional Complex, 5 inmates tested positive, with 1 testing positive at Trousdale Turner. Although recently I've just been advised that we have 1 additional positive case at Trousdale Turner to report. Late yesterday afternoon, we launched our third round of mass testing of inmates at 3 facilities as a result of aggressive contact tracing and out of an abundance of caution. TDOC, in conjunction with our medical vendor and the Unified Command Group, implemented a plan to expand testing for approximately 3,100 additional inmates at the Bledsoe County Correctional Complex, the Northwest Correctional Complex, and the Turney Center Industrial Complex. We will also test all employees at the Turney Center Industrial Complex. The decision to expand testing is based on the positive returns we saw at the Bledsoe facility, as well as extensive contact tracing from Northwest and Turney Center. Finally, I want to thank the employees of the Department of Corrections, as well as the employees of our medical provider, for their hard work and their dedication to the mission of the Department of Corrections. I also want to thank the inmate population who has been especially cooperative in their efforts to maintain a high level of sanitation within our facilities, their help in making masks and gowns that have been used across the state, and for adhering to the necessary adjustments that we have all had to make while battling this invisible enemy. I want to thank the community for their support of our officers and the frontline staff all across Tennessee. I'll be happy to take any questions at the appropriate time. Thank you, Governor.
Thank you, Commissioner Parker. Dr. Piercy, you want to give a health update, please?
Thank you, sir. Good afternoon. Many of my points today are restatements of what the 2 previous gentlemen have said, so I'll just hit the highlights. Out of our 7,238 cases, we have had 3,575 recovered. The reason that is important is for the first time, the number of recovered cases exceeds the number of active cases. Essentially, that means there are more people that have gotten over the disease that are now getting infected. That's very encouraging, and we're really glad to see that. That means our physical and social distancing efforts have worked, and so we need to keep them up. We do also know that the 2.3% increase of day over day is our lowest ever, which means that now that we've had 17 days worth, it's probably safe now from a medical standpoint to start relaxing that a little bit. So those numbers are important for everyone to make note of. Other numbers that are important that we're really proud of, as the governor mentioned, more than 11,000 tests were done just on Saturday and Sunday through our sites across the state. We had 33 sites. Several of those, the majority of those were the pop-up drive-through sites that were the key success was through the National Guard, as well as we also had some brick and mortar sites available. The thing to remember here is that, as the governor mentioned, our brick and mortar health department sites are doing free testing every day, every weekday, and you don't have to wait in your car and you don't have to wait in line. So I encourage you, if you think you need a test, don't wait until Saturday or Sunday. Go ahead and go to your health department now. Speaking of the coming weekend, we will have additional sites, new sites, different than the ones we had this week, and that list will be available soon, so keep an eye out for that. As Commissioner Parker said, he and I have worked very closely together along with the rest of Unified Command, as well as his medical vendor Centurion, over all of the mass testing that's taking place. There is about 3,600. There are about 3,600 tests that are going to be ready in the coming days. That is a combination of the mass testing at Bledsoe, as well as Northwest and Turney unit-based testing and staff testing at the Turney complex. Just wanted to give you a heads up on what to expect on those numbers. So the Tennessee Department of Corrections lab vendor for their medical provider is out of state, and so that reporting might be a bit delayed. You will notice that if you look at today's case count, the Bledsoe County count still only has 10 positives. That's because it has not yet been recorded in those numbers, what we've already been told verbally about those results. Likewise, many of the results from that additional 36 or 3,700 tests that are going to be coming in later this week It will take several days to get that posted on our daily case count, so I just wanted to let you know what to expect there. Finally, I do have a report or an update on our nursing home data report. You may have seen that the Center for Medicare and Medicaid, what we call CMS, did come out in the last day or so with a federal mandate for nursing homes to be required to report a positive case in their facility to residents and families. We see that as a very good thing and causing facilities to take responsibility for those notifications to families and residents. Not sure yet on the time frame or the exact details, but that was announced in the last 24 hours. I'm also letting you know today that on Wednesday of this week, you will be getting a nursing home report, or a long-term care facility report, I should say, that in addition to the list of facilities that we put out every Friday, we will now start reporting the number of cases and the number of deaths combined for residents and staff in each of those facilities. Also in that nursing home report on Wednesday, we will be giving an overview of the process just so you can get a better look at what we do when we identify an outbreak in one of these healthcare facilities. That'll conclude my reports for today, and I'm happy to take questions.
Thank you, Dr. Piercy. We will take questions, but before we do, let me just say, you know, this briefing provides a lot of encouraging information. The numbers are in the right place. They're headed in the right direction and continue to do so. We see the opportunity to open up state parks and to begin to open businesses and to reboot our economy beginning next week and into May. Those are all very encouraging, and we're all very grateful for the work that has been done, particularly the work that you have done individually to do what you are asked to make sure that we found ourselves in this position. That being said, it is more true than ever today that our efforts in social distancing are important. They are important so that we can in fact open businesses and in fact open the next phase and begin to move out safely into the community. But the only way to do that is if Tennesseans remain committed to social distancing in whatever activity it is that you do and wherever it is that you go, in whatever workplace that you find yourself entering. The mandate to stay apart, the personal mandate, it will be lifted as a mandate, but it will not be lifted as something that is necessary for all of us to participate in. So I encourage every one of us. We have much to be grateful for, and we have much to be hopeful for, and it's all because of the efforts that Tennesseans have made from one end of the state to the other to do their part and stay apart. We'll continue to do that going forward. I'll be happy to answer questions. And remember, we have members of our Unified Command Group here. General Holmes is here from National Guard, for Department of Military, Department of Health, Department of Corrections. So lots of folks here to answer any questions you might have. Happy to take your questions.
Thank you, Governor. First, we'll go to Kim Crucy with the Associated Press. Kim, your line is open.
Hi, Governor.
Hi, Kim.
So you talk about flattening the curve here in Tennessee, but when you look at Tennessee's prison population, do you believe that there has been enough testing done on the inmates? Do you think that there needs to be more now that we're getting higher numbers in Bledsoe County facility and yet another round of mass testing that's happening on the inmates?
Yeah, that's in fact what we're doing, is rapidly expanding our testing population and our prison population testing. Tony, you want to make a comment of that, or Dr. Piercy, either one on numbers?
So thanks for the question. I would just comment that we are aggressively looking at contact tracing across the Department of Corrections. We're spending a lot of resources and spending a lot of time in following up on these positive cases or even suspect cases. In many cases, we are what I've called proactively testing, in many cases, asymptomatic individuals in our facilities just because they may have lived in a unit where an individual who we know tested positive worked. So we are really, I think, taking an aggressive approach on that. And I would just say that we will continue to evaluate the results that we see in the days ahead. I know we have on tap for 3,100 tests to be conducted. We should get those results back within the next 4 to 5, 6 days, hopefully. And at that time, I would evaluate those numbers along with my consultation with the Department of Health and Dr. Piercy and the Unified Command Group to make a decision going forward about additional testing. And I would let Dr. Piercy comment on that if she wants to.
Commissioner Parker is correct. We have somewhat of a tiered approach to testing that population. We have been in consultation with other states, and I talked to several of my colleagues in the South just this morning about their approach to prison populations because, as you very aptly pointed out, it is a vulnerable population and it is a population that can have spread very quickly because of the contained environment. So our approach generally is that when there is a case identified through contact tracing, just as Commissioner Parker said, we do testing of those individuals, and then if there is a high prevalence of disease amongst those, then we expand to a more unit-based testing, which usually encompasses several hundred, and then just like we found at Bledsoe over the weekend, if there is a substantial proportion of positive cases amongst the unit, then we'll expand to widespread mass population testing. That is the approach that we're taking, which is entirely consistent with what the rest of the nation is doing at this point.
So currently no plans to just do a blanket. If any inmate wants a test, they can have a test if we're going off of this tiered approach?
The tiered approach is exactly what we're doing in the general population, which is when we find somebody that needs a test for any symptomatology, which is the threshold that we're using in the general public right now, then we provide that testing. And then even if they don't have symptoms, if they have been in contact or in the same area as a positive case, we provide testing on a more widespread basis then. It's the same approach that we're using in all of our other vulnerable and contained populations, specifically nursing homes and other group homes.
Thank you.
Thank you.
Next, we'll go to Natalie Allison with the Tennessean. Natalie, your line is open.
Hello, Governor. I have a couple questions about this decision not to extend the stay-at-home order. I know that you all are still working with these industry leaders to determine what's going to happen when. But can you give us even a big picture idea on what businesses you are planning on having reopen first on Monday of next week, first of all, and then secondly, what is it going to mean not just for businesses but gatherings around the state? So softball games, races, things like that. Can you speak to those big picture questions?
Yeah, we plan to keep the same social distancing guidelines in place even beyond and into the next few weeks. So for now, and up until this May 1st date, which is what we're dealing with now, we'll continue to have the same restrictions with regard to social gatherings, the numbers of people in social gatherings. This change is primarily around businesses and businesses being able to open up. The most important thing to me is that people can get back to work and businesses can begin to reopen. The economic difficulty that's been created by this it has been devastating to our state, and the sooner that we can begin to change that picture, the better. So these changes that are announced today are primarily around businesses. We don't know which businesses will be targeted for opening on Monday, but we will within just a couple of days, and then we'll announce the other businesses that will be targeted on Friday. But the social distancing requirements will stay in place.
As for working with the mayors and leaders in the state's largest areas, is that going to be basically those local leaders will determine when businesses can reopen, or what is that process for working with them, and how soon would you like to see most businesses reopening in Nashville and Memphis and Knoxville and places like that?
So I've spoken with the mayors from those from all of those counties that do not have health departments that are run by the state, and that's the delineation. There are 6 counties in our state who have health departments that are not overseen by the state, and so for those leaders in those communities, we've been cooperative throughout this process, from the beginning of it through the different requirements that were put in place all across the state. As you know, they were done differently in those municipal areas than they were broadly in the other counties in the state, and that's how we will reopen this state as well. It'll be phased, it will be smart, it will be strategic, and it will make sure primarily that the health and the safety of Tennesseans is put first. We know that we want our businesses to open and we need our economy to get started back. But we know too that we can do that in a way that's safe and that allows for the safety and the health of Tennesseans to continue to be utmost. So I've spoken with those mayors and we've talked about a spirit of cooperation, but they will be providing their own outlines. We will be talking back and communicating with with one another about what those are, in a hopes that they too can return to a place of safely opening the economy all across the state at the right time.
Next, we'll go to Kara Hartnett with the Nashville Post. Kara, your line is open.
Hi, thanks for taking questions.
Mm-hmm.
When do you think you'll have a proper understanding of how far coronavirus has spread throughout the state?
A proper understanding of how far it has spread?
Like the infection rate.
You want to speak to the reproduction rate? It's fallen below 1.
No, the infection rate overall in the state, like 2% of the population has been infected.
I mean, the data, we know how many people have tested positive for that. We do know that there are asymptomatic cases out there that we certainly don't know about, so we don't know the number of infected cases, which means that we can't know the percentage of population that will be infected. That would just be a projection. We can only look at data as it develops, and you can only look at data as it is on the ground day to day, and we track that data so we know how many cases and how many infections that are confirmed, but of course we don't know how many may be carrying the virus that we have not tested yet.
How do you reconcile that with undoing mitigation efforts by reopening the economy?
Because we know that with broad testing, and particularly with testing people with symptoms, that we have an understanding about the rapidity with which the disease spreads. Let me let Dr. Piercy talk about that reproduction rate and how that is a good indicator of what's happening in the spread of the virus across our state.
The governor's correct. When we look at how fast a disease is spreading, we look at the reproduction rate, which is, if you see it in writing, it's R subscript 0. And what you ideally want is you want that to fall below 1.0. When we first started, we were at the 2 to 3 range, in 2.6 or so, and the last estimate was 1.3 and maybe even a little bit lower. I haven't gotten an updated number on that in about a week, but that's one of the important numbers we look at. Another important number that we look at is the day-over-day percentage increase. When we first started measuring this, there were some days that we were having 14, 15, even 18% jumps in day-over-day case count. What I mentioned earlier is that today it was 2.3%, which is the lowest day-over-day increase that we've had since we started measuring it. So I think what your question was is sort of, when will we ever know how many Tennesseans, what percentage of Tennesseans have it? And you have to remember that it really is not practical to test every single person in the state on any one given day because that just tells us that day's snapshot. So the other indicators of the reproductive rate and the day-over-day percent increase are the two main variables that we watch.
Well, I guess I'm wondering how you know those metrics are accurate if you don't know how it's spreading among asymptomatic patients.
I think asymptomatic positivity is something that's very interesting in the field. We know that the elderly population has a higher asymptomatic rate. Quite frankly, we're learning that our prison population has a higher asymptomatic rate than we thought. That is helping us learn more. These are things that we wish we knew, and we learn more every day, but that's why they call it a novel coronavirus. It's brand new, and so we're gathering more science with each passing week.
Next, we'll go to Sam Stockard with the Daily Memphian. Sam, your line is open.
Yes, thanks, Governor. I appreciate your time.
Yep.
The Memphis Restaurant Association is requesting or preparing to request that you allow them to open at 50% capacity on May 1st and 100% capacity a month later or so. Is that something you can agree to? And are there other restrictions you're foreseeing for restaurants? In fact, some people have been saying these restaurant closings have even been unconstitutional. Can you answer those two or three things?
Yeah, we're working with the Restaurant Association right now to develop those measures that are important for a restaurant to open safely. You talked specifically about Memphis, and that Shelby County will have their own requirements on their restaurants. They may be the same as ours. They may be a different timing than ours. As I said earlier, we're going to put guidance out for the counties that have state health departments. Shelby County is not one of those counties, so what exactly will happen in Shelby County may be a little different than what happens in the rest of the state, but that's exactly what we're doing. We're working with the Restaurant Association, those who represent the workers, to make sure that we put in place the measures and the guidance and the guidelines for restaurants to open safely for their workers and for their customers. And when we do so, then we believe that will be the time when those businesses can open safely.
What's your response to people who say that these shutdowns have been unconstitutional?
Yeah, well, what's most important is that these shutdowns occurred in order to save people's lives. And Tennesseans have done what Tennesseans needed to do, and that was to put in place the measures and to follow those measures to do just what was necessary to stop the spread of a deadly virus, and they've done that. And we certainly cannot entirely stop it, but to slow it to a point that we can manage that spread, have the capacity on our healthcare system to take care of it, and allow Tennesseans to operate and run their businesses at the same time. That's the goal, and I'm grateful that Tennesseans have done what they've done to get us to the place where we are, and we are encouraged to move forward.
Thank you.
Next, we'll go to Phil Williams with News Channel 5. Phil, your line is open.
Good afternoon, Governor. Last week, you and Commissioner McWhorter told lawmakers that you were looking at constructing some backup facilities for hospitalizations, just in case when you reopen the economy, there's a surge and a need for more hospital beds. Is part of your message that we are going to have to accept a higher level of hospitalizations and maybe even deaths to keep the economy open?
Well, the message is that we know that until there is a widespread vaccine, that COVID-19 will exist in the society out there. But the message is that we can begin to open businesses and remain safe in a way because of the way that we change the way we do business, and that is what our effort is. The message is that social distancing is what has slowed the spread of this virus and contained a widespread virus that may have killed many more people and sickened many more than it would have if we hadn't imposed social distancing requirements or guidelines. We will continue to use that social distancing going forward because that's the way we can safely open businesses. That's the message, is we want to allow people to work, allow people to live, allow people to move in their society, but to do so in a safe way. And we want to give guidance and measures and guidelines so that people can do just that.
But if there is a resurgence in this virus, are you prepared to shut the economy down again? Or are we just going to have to accept that that's part of the new normal?
Well, I think that we certainly know that, and we will actually, our strategy is to work with the local health departments in counties all across this state to monitor what's happening in an individual county. When there is a rise in cases that presents a particular level of danger in a county, then we'll work with that health department to make adjustments necessary in that region to make sure that we don't let the virus, develop to a range or to a place that causes a real problem for us. It's going to be really important, and that's why we'll continue to say that it's really important that Tennesseans continue to understand that this virus travels with contact, so social distancing is the way to be safe. And we know that Tennesseans can be safe and operate businesses at the same time. We believe that's going to happen, and we're planning for that. But we're also planning for should there be a rise in some region or in some county or in some spot, that we will respond to that accordingly.
Thank you, Governor.
Yes, sir.
Next, we'll go to Ainsley Daniel with WJHL. Ainsley, your line is open.
Hi, Governor Lee. Thank you for taking our questions again. A couple questions for you. The first one is, why are liquor stores considered essential as opposed to other businesses?
Well, there are a lot of businesses that are essential that provide alcohol, that provide food, that provide goods and services. There are a whole number of businesses that are deemed essential. Let me just say this too. As we think about, we classify businesses as essential and non-essential. There's really no business in our state that is non-essential to the economy of Tennessee. That's one of the reasons why it is so important that we get our economy back on track. Small business owners who have created a business and that's been their livelihood, and it has been what they have built up to send their kids to college or to pay for their mortgage or their rent or the services. These are essential businesses to those people. And it's one of the reasons that we need so badly to make sure that we impose and continue to follow social distancing so we can be safe and allow those business owners to reopen those previously deemed non-essential but truly essential to the lives of Tennesseans. And there are a number of those businesses across the state, and we hope to open them as soon as possible and as many as possible, and do it in as safe a way as possible.
And another question for you, do you have guidance for any of the schools on prom or graduation?
I can't answer that question, but we'll look at that. Penny Schwinn, our Department of Education Commissioner, is not in the room with us today, but we certainly will look at that and provide that kind of information. I haven't been asked that question personally. I would guess our Department of Education has, but I'll look into that.
Thank you.
Thank you.
That's all the time we have for questions today, Governor, if you'd like to make a closing statement.
Oh, thank you very much for being here again today. And thank you, Tennesseans, for doing what it took to get us into this place, to be able to announce the opening dates of businesses, to be able to announce the rebooting of our economy, to be able to announce numbers that put us in a position to do this and to do it safely. It is a very encouraging day for us, and it's because of the efforts that you have taken, the sacrifices, great sacrifices that many have made, and I'm encouraged where we're headed. So thank you for what you're doing. Continue to do your part and stay apart. Thank you.
Appreciate it so much. For areas less affected by the virus, we've issued new recommendations about how to safely resume elective treatments. HHS has also distributed the first $30 billion in direct payments to 1 million healthcare providers across the country. We've also invested $1.4 billion in community health centers to ensure our most vulnerable communities, including many African American and Hispanic American communities, have access to the services and testing that they need. Earlier today, Vice President Pence spoke with governors from all 50 states about our unified effort to defeat the virus. He had a great call. It was a great call, very positive in, I'd say, every way. Prior to the call, we provided each governor with a list of the names, addresses, and phone numbers of the labs where they can find additional testing capacity within their states. Many, many labs. We're providing you with a list. We'll show it to you now. If you need it, we'll give you the details. But hundreds and hundreds of labs are ready, willing, and able